Thank you for joining us for Ask a Therapist, a Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about many issues many people face every day. I'm one of your hosts, Sean Jackson. Today we're joined by Dr. Fox to talk about anxiety and different ways to cope with anxiety, what exactly anxiety is and isn't. And it was a really great conversation. So let's jump right into it. Is there things that people can do to either kind of self-cope, or what would you say have been hyper effective treatment for anxiety disorders?
So when we talk about clinical levels and some of the treatments, we have some really effective treatments that have actually been around for a long time. And kind of the gold standard is what we call cognitive behavioral therapy. And that's just a process by which you work with a therapist to help you kind of understand your relationship between your thoughts, your emotions, and your behavior, and how they interact, and then begin to take some of those thoughts. Anxiety has a tendency to kind of skew our thinking in a certain way, and we just have to learn ways to either reframe some of those thoughts or even challenge them outright. A lot of times, we have, some thinking that isn't necessarily really based in fact. And it's, there's also that, what we call with anxiety, we call experiential avoidance. And so it's this really active process we tend to undertake to avoid anything that we might experience some anxiety. So we stop doing a lot of things that we would normally do, or we actively work to avoid things without really knowledge that it's actually going to produce that kind of anxiety. And oftentimes what we find is that when we're able to challenge some of that, we find that our thinking around that is actually way worse than the actual experience. And so it's learning to kind of do that. There's also a type of therapy called acceptance commitment therapy that is another form of CBT that uses a lot of that mindfulness, kind of the meditative practice to recognize those thoughts, learn how to let them go, and then basically decide on what is your valued action that you want to take, and learn to take it even though it makes you uncomfortable. And it's really sort of coming to understand that anxiety is kind of a normal part. We learn to kind of tamp it down a little bit and then take that action so that the next time it makes it a little easier. Because every time we avoid it, it makes it harder to take that action. But each time we take that step and realize that it's not as bad as we probably thought it was going to be, then we're more willing to take that action the next time. And then, on top of that, there are certain medications, and I would be the first one to tell you that I think it is a tool. Medication is a tool. It's a very effective one, but it is not the first line. That therapy, coping skills, and things like that. That's always going to be your first line. But if that's not managing your anxiety adequately enough, then obviously we look at how do we address it more from a biological standpoint, because, anxiety, clinical, anxiety that rises to the level of needing that type of treatment is a disorder in the sense of there is an inefficient use of the neurotransmitters in your brain. And so the first line of defense is actually the antidepressant classification of medications. I think not everybody understands that we actually treat anxiety with antidepressants much more effectively than we treat anxiety with what were traditionally used many years ago, the anxiety meds like Xanax and Valium. Those aren't long-term. Those work for that panic attack you're having right now. But the antidepressants work because they help your brain utilize the neurotransmitters that you have more efficiently. And interestingly enough, depression and anxiety kind of live and grow out of the same neurotransmitter system. So if it's not uncommon for somebody, if you have anxiety, to probably also experience depression or vice versa. Those two kind of are go hand in hand quite frequently. So if we treat them, we can treat that very effectively, particularly that general anxiety is kind of always there. And it may not take it away completely, but instead of it being up here all the time, and so every little thing that you encounter just pushes you over the edge, we now bring it down here and you add some coping skills on top. So now all those little things that get thrown at you, are much more manageable for you.
Yeah, that makes total sense. And I've even had myself where, I've needed to evaluate my own thinking patterns, so kind of going back to that thought process of, just reevaluating the situation, what's really going on, challenging those thoughts and saying like, no, like I recognize that this is incorrect thinking and, this is what's really going on. Nothing bad's going to happen to me if I do that, this and the third, and, being able to lead myself into the action as well. So I've experienced many of those very same things. So
yeah, we tell people a lot. Sorry, I didn't mean to cut you off, but we tell people a lot that thoughts and feelings are not necessarily fact, right? We can think a lot of things that aren't based in fact, and so really that exercise of kind of where is this thought coming from? Is it based in some fact? Am I taking one experience I had and applying it, to everything else? That kind of thing. Those are all great exercises to kind of do. I'll give you one more that I think is really, really effective. It's super easy and it almost sounds too good to be true, but it comes out of the realm of positive psychology, and it's either called 3 Good Things or What Went Well, and it's a process of just journaling every night 3 things positive that happened during your day, and really kind of spending some time to reflect on them. With the kind of rule that you can't repeat the same thing night after night. So it's got to be 3 unique things each day. And it's been proven, it's so effective. They use it in the military. And it helps to sort of shift your thinking. We have a tendency to kind of put a lot of emphasis on negative things and sort of discount some positive things. And what this does is helps shift your thinking to be a little bit more balanced, and give some credit to those positive experiences, which builds capacity for you to kind of manage the day-to-day things that are coming along. So it's a really effective. Most people find that if you can do it pretty consistently for at least a month, and it's a practice I do periodically and revisit as I see the need to. It really is something that you will notice at the end of that month, like you are so much more focused on what positive things happen during the day, even the small things, that those negative things that inevitably are going to happen just don't seem to have as much weight.
Mm-hmm. Yeah, makes total sense. And having been in the military, I've seen it used.
Figured you might have some experience with that.
It was always phrased as just that. We start off the conversation with, okay, what went well? And we go down that whole list of all the things that went right, even if it's only one thing that went right. And then even in the next part to not continue to dwell on the negativity is, okay, what could be improved? Not that it went wrong, but what could we have done better? And it kind of brings you back to that point of not just pointing out the problem, but also kind of bringing up the solution, for it whenever you say what could have been done better. So I find that really interesting and, very useful, even for myself, on a personal basis. I tend to do it very much professionally, even with my own colleagues, my own team, ask them all the time, like, hey, what can I do better? How can I make this better? So I think that's a natural way of thinking, that
a
lot of us could do better.
Yeah. It's a great way to focus a team. That's a great thing. I think you can bring it in, not just individually, but even, if you're working with a group of people, like, there's a tendency to kind of really focus on those negative things, and that weighs us down and that creates added stress and anxiety. So making sure that we're also attending to those positive things. And it really, as you do this exercise, reflecting on it and really kind of trying to kind of imagine going back, putting yourself back in that position has a really impactful way of kind of shifting your mindset and kind of getting away from the the default being the negative. You're sort of pushing it more towards the middle. And, I don't think I'm not trying to say by doing this, you're going to become like the super optimist, but you are going to create more optimism, which is actually a skill. We don't think about it. We think, well, either you are an optimist or you're not. Well, no, you can actually develop that. And the more optimism or more optimistic that you become, the more options you will see in those stressful environments and not be overwhelmed. It gives you, like I said, more capacity to kind of deal with it. So,
I love it. I love it. So we've talked a lot about how to, kind of deal with anxiety ourselves, what some of the clinical, side of it looks like. And we talked in the beginning about how it's common for a lot of people to dismiss anxiety because they can't see it and things like that. So in your opinion, what are some ways that others can help, somebody that is dealing with anxiety? How can we effectively help that person, especially in that moment, whenever they're in that impending doom and, just kind of stuck in that cycle? What can we do to help them?
Yeah, it can be a little challenging because in that moment, that person may be so overwhelmed, that their experience, it makes it hard for them to see anything beyond that. So I think the real thing, the real help there is helping that person sort of step back from the emotion and that intensity, to try to give them a slightly bigger perspective. It can be a doom or gloom kind of situation for that individual, but kind of saying, let's step back a little bit. Let's look at this from a bigger perspective. Is this something that's, completely unsolvable? It's probably not. Most of the time, the situation has a solution. It's just hard to see when you're in the middle of it. And so helping them kind of problem solve, work through that. Sometimes it's just supporting them and validating, like, what, if I went through what you're going through, I'd experience that too. That seems pretty normal, because it is, right? Somebody that's dealing with anxiety, it's completely normal. Now, whether or not it becomes debilitating, that's the next thing is sort of recognizing, hey, if it's really something that's occupying all of your time and energy, or it's preventing you from doing things, let's talk about how to address that. And maybe, something as simple as, to bring this back to what we do, my team provides some health coaching around that. We have some specific programs that you don't have to necessarily be debilitated by your anxiety, but would just like to develop some more effective coping skills or understand it a little differently. And we have health coaches that are really, really effective at just kind of guiding you through that process and giving you lots of good information and helping you figure out what works best for you. Because that's the other piece, is that, not every strategy and skill works the same way for every person. So sometimes it is a little trial and error to figure out what makes the most sense and how that can be implemented for you. So we provide that. And then if we need to connect you to a therapist or other resources in your community, we obviously can do that. So, anybody can reach out to, call the mental health number on the back of their insurance card and get to us in CBA. And we have a whole team that will help kind of walk somebody through that process and help them develop some good goals around how to manage their anxiety. And then if they need additional resources, we're there to help with that too.
Yeah, that's amazing. And I don't even know that I realized that the depth that service, really went into. And I think that's super cool and super valuable. He said it's just as easy as calling the number on the back of their ID card, and they'll be able to get access.
Call that number. That it's 868-1032. It's the number for the mental health, and it'll get you into our call center. You basically just tell somebody you'd like to have some information on our health coaching program, or that you'd like to talk to somebody about how to manage your anxiety, doesn't really matter what you say. We'll get you connected with the right people, and they'll work it. They can do it telephonically. We can do it through the My Health Planner app. Do messages, stay in contact with that coach, and they'll provide you with different resources. They'll teach you different coping strategies to help you kind of identify some of the things that would be helpful to you, as well as maybe I even identify some of the things that are maybe causing some of that stress that, sometimes we just get so used to our lifestyle that we don't even recognize that, we're really living in this churning environment of stress and anxiety, but we become so used to it. It just seems normal to us. And, so sometimes it's just identifying those little things like that it's like, gosh, I never even realized if I made this one simple lifestyle change, I have this, significant reduction in my stress and anxiety. So that's a lot of what our coaches, and all of our coaches are licensed therapists as well. So, and they're certified to do this type of coaching. So they understand it from the clinical side. They don't do the therapy, right? They leave that to the therapists out in the community, but they understand the diagnosis or the issue from that clinical perspective, and then help you kind of walk through the process. And they're just great partners in that. I think they're just really good to kind of walk alongside you and help you navigate it.
Yeah, that's so awesome. So awesome. So what, as we close out here, last two questions for you. Are there any common misconceptions? So kind of our Mythbuster segment here. Are there any myths about anxiety that you want to debunk for us today?
Well, I think the biggest one is that anxiety is somehow a weakness or a character flaw or something like that. Because I think we said early on, well, just because something, you experience something as anxiety, it doesn't cause anxiety for me. So therefore, there is something inherently wrong with you. It is that's the first thing, is that it's such an individual thing. And what we often don't know is what a person's entire history is, right? So what you don't know is that they have tons of experiences in their life that have all culminated to kind of create this situation that you probably have no idea of. So, if you had lived through what they had lived through, you may very well be experiencing similar kinds of situations or feeling it the same way. So I think that's kind of a big one. And then I also think that I think another myth, I don't know how much of it is really a myth, but I think there's some reservation that therapy actually really works, and that people engaging in therapy, even if your anxiety is not to the level of well, I can't function. Well, why are we waiting to get to that point? There are some ways to be very proactive with this and work with a therapist to kind of develop your own plan of care to really increase your capacity to manage this and maybe prevent it from getting to that level that it's so debilitating. So those are kind of the two main ones. I think, one of the nice things, if there is such a thing as a nice thing that came out of the pandemic, is that there is this focus on mental health and making it more and more okay to seek services and really address your mental health. And I would say mental health and wellness. I think a lot of times we think about it as we only address it when there's a problem, but I think there's some wellness aspects of that just like our physical health, mental health is just one aspect of our overall total health. And so taking those steps to practice good mental wellness, I think is also really important. And I think we've seen a shift, and I hope it continues to see people being more sort of in tune with that and accepting of that in larger society. So I'm hopeful for that.
Yeah, absolutely. Absolutely. And last question, looking ahead, are there any kind of recent developments or anything kind of cutting edge in terms of like treatment of anxiety that you've kind of been monitoring and finding interesting right now?
Yeah, there's some really good work being done. It kind of started in the area of trauma treatment, and it has to do. There's a couple of different what they call the processing type treatments that involve like bilateral stimulation, eye movements, things like that. That on the surface, when you look at them, you're like, this does what? Like, that doesn't make any sense to me. But they're really, really effective ways of sort of transitioning some of that emotional intensity and transitioning it into a much more a level that's easier to manage. And so there's some unique and new. One is called EMDR. That stands for eye movement desensitization. It's been around for a while, but it is gaining, and there's some offshoots of that are really gaining some traction in really applying to just general anxiety. So any kind of intense emotional experience, this type of therapy tends to really reduce it to the level that it may not be gone, but it is so much more manageable for the individual that they then can apply other strategies to. And so we're seeing this being applied more broadly for these types of disorders and seeing really, really significant improvements and really effective outcomes with this. So I suspect we will continue to see things like that, that because this has become so much more of a significant issue, we're seeing, they're attending to it with some different approaches that thus far are proving to be very effective. So that's
awesome.
Another area that I think we'll see a lot of growth in.
Awesome. Dr. Fox, this has been amazing. I really appreciate all of the information, all of the advice, everything that you have to offer, everything that your team does. On the health coaching side, we certainly appreciate it. And hopefully we will have you back on soon to talk about more mental health topics.
Well, I'd love to. I appreciate the opportunity to kind of share all the information. So anytime this comes up, I just love getting the information out, and I appreciate having that. This is a vehicle to do that. So thanks again.
That's perfect. All right, Dr. Fox, we'll talk again soon. Thank you to the listeners for tuning in today. This has been Ask a Therapist, a Blue Cross Blue Shield of South Carolina podcast where we dive into mental health topics. Be sure to check out other episodes of Ask a Therapist for more mental health advice, and we look forward to seeing you on the next one.